Hello everyone, my name is Sama Al-Fathi. I'm a student pharmacist from the University of California, San Diego. Today I'm going to talk about the use of insulin pen. There are different types of insulin pen, and you should talk to your doctor about the best one for you, and he can prescribe you the perfect treatment that help you control your diabetes. Um, like if when you buy or when you get insulin pen from the pharmacy, they will come already pre-filled with the insulin, and you can store the unused pens in the refrigerator, but the one that you use in the you start using, you would normally store it at room temperature. And the reason we store it at room temperature, that when we inject the insulin pen in our skin, we don't have a painful injection. Today we will have a sharp container, alcohol swab, and the needle that is specially made for that pen. So we are going to use this insulin pen to inject at 90-degree angle. We're going to, since this insulin pen is not for human use, we are going to pretend this is a fold of my skin, and we will inject at 90 degree in this area, which usually 2 inches away from the belly button. There are different sizes that you can inject yourself: the abdomen, the back of the arm, the thigh, and the buttock. And it's your choice. You preferably, every time you inject yourself, rotate these sides, or at least 1 inch from the previous site you injected. So this is the needle, and I'm going to start opening the insulin pen and screw the needle into the insulin pen. And I will swipe the side of my skin where I'm going to inject. You start with dialing the number of units before you inject. So I'm going to pretend that I will need 20 units, let's say. If you go up, you can always go back to 20. Doesn't matter. It's not the end. It's okay. Now I'll remove this. Remove the cap and the ends. I will inject at 90 degree. And again, I'll pretend this is a fold. 1, 2, 3, and we'll push and keep for 10 seconds until all the insulin leave the insulin pen and enter the skin. You can also put a band-aid optionally if you need one. Now we will put the pen in the needle of the pen in the syringe in the sharp container. So all we have to do is put the cap back on, untwist, and throw the needle in the sharp container. And put this back on. We're going to talk about the pros and cons of the insulin pen versus insulin needle. Insulin needle usually need to be, you actually have to fill the insulin from the vial. While in the insulin pen, the insulin already is pre-filled with insulin, so that would save you time. Instead of preparing, you can just take the insulin pen and inject yourself, which help with the adherence, and that way you can take your medication at the same time every day and without missing any dose, and that will help with controlling your blood sugar. However, insulin pen are more expensive, so that's the pro and cons for like is it, the needle is more cheaper, but the pen is expensive.